My name is T.I. Kim. I go by initials. I just joined this July as an assistant professor of marketing. Just to give you a background, I have an electronics engineering degree from Canada, but I soon after that I switched to study management at Stanford and got my PhD in marketing from UC Berkeley. And I was an assistant professor of marketing at Emory University for a few years before I joined UTD. My research mainly evolves around the intersection between marketing and healthcare. I've worked on projects that looked at the effect of hospital advertising on patient demand, as well as patient outcomes. In other words, is hospital advertising effective? And I found that was the case. And also some states wanted to ban hospital advertising because hospitals use a lot of government subsidies through Medicare and Medicaid, and they funnel that money for marketing. So there has been some resistance at the state level. I find that banning hospital ads can actually hurt patients because higher quality hospitals advertise more to signal their quality to patients. Another project I looked at whether doctors' prescription behavior can be influenced by drug ads on television, which is usually meant for consumers. So I tracked doctors who move from one area to another and get exposed to different levels of drug ads on television to see if they get influenced by that. And I found that that is the case, and also the effect is larger on less experienced doctors. Another project that was recently published is can Viagra advertising have an unintended spillover effect on birth? So the title was, can Viagra advertising make more babies? So we used a 10-year hospital birth data in Massachusetts and also 15 million birth certificate data from the US to get at causality using quasi-experiment design. And we found that that was the case. And this was published at a top marketing journal, but more properly, it was featured in Daily Mail in the UK. So I typically deal with a very large individual patient level, physician level data, and I use economics and statistics to answer these research questions. But I also work with the physicians to answer various questions unrelated to marketing. So for instance, we're currently studying the effectiveness of robot-assisted surgeries using patient-level records. With another team, we've also looked at opioid addiction issues related to public policy changes. So I'm generally interested in patient choice of healthcare providers, hospital operations, and also public health in the healthcare industry. Going forward, I'm interested in studying market expansion of hospitals, including merger and acquisition of individual providers, which was a concern because hospitals are gaining more power as monopoly now. And also I was interested in how to improve patient compliance in drug adherence using marketing means. How do we convince patients to take their drugs on a more regular basis through marketing means? Also, the prevalence of walk-in clinic and urgent care clinics has been increasing, and I wanted to look at how that impacts patient utilization of these facilities and how does that affect their health outcomes, especially for low-income families and also possibly for vaccination efforts for COVID-19 in the future. So ideally, I would need patient-level data from large insurance or data from hospitals. So if you, and also data from Medicare and Medicaid, which tend to be quite expensive. So if you want to collaborate on these topics, or if you have good contacts at hospitals or insurance side, give me a call or email. Thank you.